subsequent care of a premature baby. Okay, on the subsequent care, on this point, the first thing that you need to do after you've discussed the immediate care is to talk about the observations. So you need to do observations. Now, under observations, our first thing that we need to discuss is TPR, that is the temperature, the pulse, and the respiration, because once we do this, they are going to serve as our baseline data. So we are going to be noticing these vital signs hourly. So we're going to monitor the temperature for hypothermia and to rule out infection. So the temperature should be between 32.6 degrees Celsius to 36.8 degrees Celsius. Then the pulse rate or the heart rate, we're going to monitor the cardiac functions. So on this cardiac function, we expect the heart rate to be 120 to 160 beats per minute. That is the normal. And then the respirations, we're going to do or to count the respiration to detect any respiratory difficulties. Then we're going to observe the skin of the baby, okay, for color, in order to detect cyanosis. Then we're going to watch out for signs of jaundice, and then we're going to do daily weights and weight gain. The reason we'll be doing this is that we want to notice if the feeds that we're giving the baby are actually improving the baby's well-being. So the weight should be about 100 grams to 150 grams per week. Then we're going to observe the feeding pattern of the baby. So all these things that we are doing here, we are trying to check if the things that we did in the immediate care are taking effect. Okay, so now after you talk about the observations, then you can talk about hygiene. Under hygiene, you can do top and tail. So you're doing top and tail to promote circulation and to promote hygiene, of course. Then you can do cord care to prevent infections. You can change the soiled linen and nappies for comfort. You can also allow the mother to participate in the care of the baby to promote mother-baby bond. After you do the hygiene on the baby, then you can also do you can give IEC to the mother, meaning you can educate the mother on the importance of hand washing and infection prevention measures. You can stress the importance of keeping the baby warm. You can educate the mother on the danger signs such as fever, fits, abdominal distension. You can also explain to the mother the importance of immunization and children's clinic. Then you can explain the importance of feeding the baby regularly, as well as stressing out the importance of review dates. Okay, so those that is the management that follows. That is the subsequent management. Now after management, we can look at the complications. Let's look at the complications of prematurity. Complications of prematurity, one of those complications is hypoglycemia. Hypoglycemia is due to poorly developed glycogen stores and poor feeding. It can be due to poorly developed glycogen stores and poor feeding. Anemia is another complication. This anemia is due to low iron stores as a result of short intrauterine period. So you're looking at the capillaries because these capillaries are weak and therefore there is tendency to bleeding, which may lead to anemia. Okay, another complication is cerebral hemorrhage. This cerebral hemorrhage is you're going to notice that the fetal skulls, like we said, under the head, that they are very soft, meaning they are fragile, and therefore you're going to find that there is no protection to the brain. There is also vitamin K deficiency. It can also lead to cerebral hemorrhage. Then edema. Edema is due to poor muscle tone and inadequate venous return, which causes accumulation of fluids in the extremities. Then another complication that can occur is lateral fibroplasia. So this is a condition characterized by proliferative changes in the retinal vessels, which is followed by hemorrhage, and there is a peripheral separation of the retina. Now, this lateral fibroplasia is as a result of excessive oxygen concentration, meaning if you give a patient a lot of oxygen and that oxygen is concentrated, the patient might end up with this complication. Another complication that can come about due to prematurity is jaundice. Jaundice is due to immature liver, which leads to failure of conjugation of bilirubin, which accumulates in the bloodstream. Infection is another complication of prematurity. Infection is due to premature baby born before the immunoglobulin G is passed to the baby in the last trimester. And then hypothermia is another complication, which is due to immature heat regulating center in the medulla and the thin subcutaneous fats. And our last complication that we can look at is respiratory distress syndrome. This is the major cause of death in premature infants, and this is a condition in which there is failure to maintain respiration due to lack of surfactants. So due to lack of lung surfactants. This brings us to the end of this pediatric newborn condition.